Thank you so much, and thank you everyone for joining us today as we discuss Patient Health Rights Charter as well as the Bato principles. Unfortunately, Tam is on call today, so he did contribute, but he's unable to join us today, and he'll be joining us next week. So today it's Jessica and I. So we believe that this is and an important topic to begin with, as it forms part of the foundation we took as healthcare professionals and should be the basic standard that we strive for. Health, sorry, Prof, I'm just having technical difficulties trying to go to the next slide here.
Just press your down button, maybe that will help you. Or if you go on the screen left-hand corner, you'll see on the presentation left-hand corner, you'll see the arrow. There we are. You've got it.
There we are. Yes. Thank you. Health is a basic human right, and it's important that we as healthcare professionals are familiar with these so that we advocates for our patients' health, particularly in where historically such rights were violated, were denied. So it's paramount, as per our Constitution, to strive to uphold, promote, and protect these rights. So I'll just get right into it. First right that is on Health Right Charter is the right to a healthy and safe environment. This would include adequate water supply, waste disposal, and protection from environmental dangers, pollution, ecological degradation, and infection. And this applies to us now during the COVID era, keeping patients safe by simple things like sanitizing our surfaces, washing our hands frequently, making sure that consultation rooms are ventilated is part of keeping our patients safe. And it's part of upholding their rights. The next right that is mentioned is participation in decision-making. So this would not only be, patients don't only have the right to participate in matters affecting their own health, but they have every right to be part and parcel of the development of health policies as well. Okay, access to healthcare is a big one. Number one is timely emergency care for all, regardless of ability to pay, right? Treatment and rehabilitation is also very important. And that treatment and rehabilitation must be made known to the patient to enable the patient to understand such treatments and rehabilitation and the consequences thereof. And of course, provision for special needs. With regards to newborns, for instance, newborns would need their incubators, the age. Pregnant women have access to ANC clinics and their own special casualty, the maternity casualty. Those with disabilities, that would include not only physical disabilities, but those who are deaf, those who are blind, those who have intellectual disabilities, those living with HIV and AIDS, and something that is often much neglected, those in pain need to be provided for as well. Continuing with access to healthcare, it is very important as healthcare professionals that we counsel equity without discrimination, coercion, or violence. And this, for example, would apply to a patient with living with HIV and AIDS and the ethical dilemmas that may occur there, or for instance, a patient wishing to undergo termination of pregnancy. Inadequate counseling is a hindrance to access of health, and that is something that we need to be aware of. Palliative care is very important. Palliative care that is affordable and effective is important, and not only for those, of course, who are terminally ill, but for those with incurable long-term chronic illnesses need to be taken care of. As much as we strive to save lives and to cure illnesses, we also need to keep in mind that it's just as important to improve as much as we can everyone's quality of life, our patients' quality of life. It goes without saying that as healthcare professionals, we need to have a positive disposition towards our patients at all times. And health information needs to be available to to patients, including all available health services. This may not necessarily apply to us now as interns, but it definitely will for a lot of us in future. And that's knowledge of one's health insurance and medical aid scheme. So a patient is entitled to this information, and a healthcare professional should actually go above and beyond and challenge, where necessary, the decision of such insurances or medical aid scheme relating to the member. Because our best interest is the patient, and a medical aid scheme will probably have the financial books as their best interest. So we as healthcare professionals need to advocate for them in this way. Choice of health services. Every patient has the right to choose a healthcare provider and to choose the facility that they wish to be provided. Okay. Go without saying again that every healthcare professional needs to be named. A patient needs to be able to identify you. Confidentiality and privacy is a huge one. Information concerning one's health, including treatment, may only be disclosed with informed consent, which we will discuss as well, except when required in terms of the law or any order of the court. Okay, and here we go, informed consent. Informed consent is the right to full and accurate information, not only about the patient's illness, but about the diagnostic procedure, about the proposed treatment, about the risks of involvement and the costs of involvement as well. So further on, patients also have a right to refuse treatment. I'm sure a lot of us have already encountered patients where we've had to sign RHTs, and patients have every right to do so. Patients have a right to a second opinion, continuity of care, and also complaints about health services. And of course, with all rights come with responsibilities, and I'll just go through some of these responsibilities briefly. Every patient has the right to take care of his or her own health, to care and protect for the environment, to respect the rights of other patients and the healthcare providers, and to utilize the healthcare system properly and not abuse it. Every patient has a right to know his or her local health services and what they offer. They have the right to provide healthcare providers. They have the responsibility to know his or her local health services and what they offer. They have the responsibility to provide healthcare providers with relevant and accurate information for diagnostic, treatment, rehabilitation, or counseling purposes. Patients are responsible for advising their healthcare providers when it comes to wishes of their death or their end-of-life care. Patients should comply with have the responsibility to comply with the prescribed treatment or rehabilitation procedures. They are responsible for the costs that may be related to their treatment, and of course to take care of the health records in his or her possession. Now sitting here with me is Jess, and she will go into the Bato Pele principles.
Good afternoon, everyone. I will be dealing with the second half of the presentation, the Bato Pele principles. So what are they? Bato Pele is a Sesotho word, which means people first. It is an initiative that was launched in '97 to transform the public healthcare system. As previously mentioned by Luandile, Democratic South Africa really inherited a public service that was not very people-friendly, and lack the skills and attitudes required to meet the challenges facing the country at that particular moment in time. So what do these principles have to do with us? Public servants are an integral part of implementation. The success of government's policies is dependent very much on healthcare workers. Bato Pele is a belief set that is used to improve service delivery within the public sector. It is an approach to get healthcare workers to commit to serving people and to find ways to improve service delivery. Very importantly, it also requires that the public hold the public servants accountable for the quality of service that they provide. So there are 8 principles in Bato Pele, namely being consultation, standards, redress, access, courtesy, information, openness and transparency, as well as value for money. So moving on to the first principle, namely consultation. This requires that healthcare workers interact with their patients. We need to listen to, as well as learn from the people that we serve, as opposed to taking a more paternalistic approach. Traditionally, doctors have been known to dictate to their patients what they think is best from their own point of view, without taking into consideration the opinion of the people that they are serving. Public servants need to stay in touch with the people that they serve. This includes finding out what services are needed in the community and how patients would like their services to be delivered. It's also important to understand what patients are also dissatisfied about. However, this would be a meaningless exercise unless this information is relayed back to management so that effective change can take place. The second principle we will be dealing with is standards. So a standard of service for each department needs to be set that guides exactly what service is to be delivered and of what quality or standard. This includes communicating how long services will take. For instance, within an emergency department, having a sign up that says, approximate waiting time is this many minutes. It's also important to communicate what healthcare users can expect to gain from the service. If for some reason standards are not met, patients can expect an explanation as well as an apology from the facility. So accountability is also very important within this principle. The next principle we will be dealing with is redress. When people do not get what they're entitled to from the public service, they have a right to redress. This means that the public servant should immediately apologize to them and also tell them what solution they're able to offer for their problem. If the public servant does not have a solution, they should speak to a manager or a supervisor and make sure that the problem is sorted out as amicably as possible. The public service's success and image is built on its ability to deliver what people expect from them. When complaints are made, citizens should receive a sympathetic as well as a positive response. Next, we will be dealing with access, which Lwandile has already touched upon, but I will just further expand on the idea within the context of the Bato Pele principles. So all citizens have the right to equal access to the services to which they are entitled. This especially applies to disabled, illiterate, and rural people who have difficulty accessing government services. Public servants have a special role to play to make sure that those who need extra assistance get it. Managers should ensure that these services are accessible to disabled people and that people who use wheelchairs or walking aids are able to access government buildings. Special arrangements should also be made to assist people with hearing or visual disabilities. Moving on to the next principle of courtesy. Healthcare workers are employed to help the people and to give them access to the healthcare that they are entitled to. They are not employed to hinder people or to be obstacles to patients trying to access a service. This means that while in contact with the public servants should always be courteous as well as helpful. Being rude to patients trying to access the healthcare system is not justifiable. It is important to have a positive attitude towards patients. This improves rapport and also encourages better health-seeking behavior from patients in future. The next principle is information. All citizens should be given full information about the services that they have a right to get. If a public servant does not have information, they should try and find out and help the person which they are seeing. When referring someone elsewhere, they need to be very clear about what the patient can expect to get there, what they need to take with them, and the exact person that they are supposed to be seeing. The better informed people are, the easier it is, and the easier it will be for public service to do its job, and the fewer people we will find in our queues. Public servants are encouraged to spend some extra time with people who need a better explanation or special assistance because they cannot understand or cannot access the services themselves. This includes making the use of a translator when required. And more importantly, I think more healthcare workers need to make an effort to learn a second or third South African language in order to better communicate information to patients. The next principle is openness and transparency. It is important for the public service and its administration to be run as openly as possible. The public service is there primarily to serve the people, and they have a right to these services, as previously mentioned. Many people, however, especially the poor, do not yet have access to many services simply because they do not have the information to access them. This is where transparency plays a very crucial role. The public also have the right to know how decisions are made, how a department is run, who is in charge, and what the plans and budgets for each department is. The last principle we will be looking at is value for money. It is imperative that wastage of very scarce resources is kept to a minimum. Public servants need to deliver a service that is cost-effective and efficient. It is also our duty to inform management of any wastage of resources and to find ways of saving money and time, all without compromising the quality of the service that we provide, because the patient should be at the center of our care. Thank you very much. That brings us to the end of our presentation. We have the references that we used here, and then if anyone has any questions for us, please.
Wonderful. Thank you very much. I think that's a great presentation, and I think it's in the same vein that we've seen last year, that you guys do wonderful jobs in terms of giving information and providing insights. And I think you're doing it in a manner that's useful to you as young doctors. So thank you for that. I want to say that just to help everybody understand, Bato Pele is a principle, or Bato Pele principles are there for the entire public service. Whether you go to a home affairs office or whether you go to agriculture office or anywhere in this country, any public service will have to follow the Bato Pele. Health has additionally added a patient rights charter, and with it, it actually is more like a rights and responsibilities. So it, in fact, tries to creep in that question of what are the responsibilities for patients as well. So that's just a slight difference between the two. People might have seen a lot of overlap between the two, but they're not. Then that's not an overlap. That's simply the purpose for each of those documents. And patient rights is for health department only. So the purpose, I mean, this is a useful presentation in which you can find lots of material for you to reflect. I want to ask that you think about some key documents that you think worthwhile. They might be short. You don't want to throw at people lots of documents, right? You want to give them something that you found while you're reading. Say, this is really neat. It's a nice, easy to read document. Worth sharing, please share it. So I want you to share to me the presentation, as well as those key documents, 2, 3, not overly long, something that if it's important, if it's long, but very important, you can highlight which pages, which areas are important. But this would be one of those kinds of things. So please share that. In addition to that, we would want you, and I hope you'll have done it. If you haven't, please try and address it in the next 1 or 2 days, is look for a patient scenario, not patient, but a real life scenario. It might be staff at a clinic or a situation at a clinic, a story, not a long story, something you probably came across, and that you can share in a half page, not more than a page, just a half page is probably good enough, as something of a situation, and give some questions to help a group discussion. That's to point them to to give them some meat to go through it and some provocative questions perhaps. But I think this would be a really neat way to get people to engage with all this great stuff you shared. Does that seem all right, Lwandile?
Yes.
And you guys? So please work on that. I'll expect a document, these documents in the next few days. For other teams that are going to be presenting from next week, please prepare it in advance. Email it even in advance so that we can get these things up and ready. Even as soon as we finish the presentations, they will be up on a page. And then the team, the rest of the interns can have access to it, find the leisure time to read it and understand it and engage. So that next week there can be a really nice discussion. All right? So you guys will be prepared?
Yeah.
Great. All right. I think that you'll find ways to share it, so it's not a big deal. I think the next group as well, Yuval is coming on and he's sharing his screen. Yuval, you guys will do very much the same thing. Lwandile, thank you very much. And
thank you very much, Prof.
And then just help each other to prepare, to facilitate and make sure that the group discussion is a useful one. And I think because you are looking at the material, you can share the sort of, it'll be two groups discussion in one. So it's just half an hour each next week. Okay, Yuval, you and your colleagues can go ahead and present. Are there any questions from anybody or comments? Dr. Aki, I think there were a couple of other family physicians who have come on board. Dr. Manda, Dr. Petkova. I'm not sure if anyone else.
I can just
yes, go ahead.
Say something, Prof.
Yes,
that
yes,
people have to keep in their minds that when they go for an interview, can be asked those questions for Bato Pele principles.
That's right.
So be aware of them. And then the other thing to help out to the group who is going to prepare maybe an example for that Bato Pele principles, they can go to the clinic's facility manager and ask for any redress or complaints and whatever. So the matron or the facility manager can help them with that, and they can easily present that case to have a case presentation. Okay.
Nice. Yeah, these cases are all around you. Just ask around. So all of you, when you present, remember you got to prepare cases for discussion so that it brings out some elements, important elements of your presentation where people actually interrogate. It's not a regurgitation. We don't want to regurgitate. We want to use the knowledge to reflect on a case particularly. Thank you, Maggie. Very useful.
Yeah.
Any other comments? Prof. Yes, Jimmy, go ahead.
Yeah, I just wanted to comment on that issue where they talked about, the Patients' Rights Charter. This issue of the patient has the right to choose a health facility of their choice. I just wanted comments from the presenters. What do they think about that statement? And how applicable is it in our setup?
Lwandile, do you want to reflect on that quickly?
Sorry, may you please repeat the question?
Maybe you can use that. Let's leave it for this. Use this as part of the discussion as a case. Dr. Aki said on reflecting about patients having a choice to their own facility, how do you see that in our current circumstance? But let me suggest you leave that as integrated into the case. Find a way that you can bring it in the case. All right.
Okay. Thank you. Thank you very much.
Is that all right? I think let's use that because time's not on our side for the next group. But thank you very much. I think there's not enough time. So these are the kind of questions I think would be really good to discuss in a group. Good. Yuval, go ahead. You guys can present.